Hi, we're Nia and Mary-Anne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Good morning, Mary-Anne.
Good morning, yeah.
How
On
you
this
doing?
foggy morning in this part of the woods.
Oh, well, yes, it's not foggy here, but you know what? We've had sunshine.
Well,
Ooh.
that always makes for a better end of the week, doesn't it? But
It does.
we've got fog anyway. But I'm not going to let the weather distract me from this great conversation. I always look forward to talking to you. And the question today is,
And
why would you
da-da-da-da-da-da.
want to reverse your type 2 diabetes with lifestyle rather than just control it with medicines?
My favourite question.
And we should probably just add in there that we're also talking about pre-diabetes in this and
Yeah.
metabolic syndrome, like high blood pressure, abnormal lipid profiles, fatty livers, they're all part of the same puzzle. So just to
Yeah.
say that.
I think this is a great question. And
Yeah,
also, it's really funny because I think this is a really silly question to ask in a way
I know.
now, because now we know what we know and
Yeah.
we know that diabetes is reversible. Um, of course, you and I are completely and utterly convinced that this is the only way
Yes, we
forward.
wouldn't even pose this question, would we?
No, I mean, if somebody came to me now and said, I've just been diagnosed as a
Mm,
diabetic, I'd say, oh, not to worry, let's get this sorted. We can go back and it'll all be gone soon.
right.
Um,
That's really
but
interesting.
I think it's really interesting because people aren't getting the message that this is possible from their doctors. And only this week I read that the public, now I'm going to get this wrong, so bear with me. It's called the Public Health
Oh,
Collaboration,
yes.
who
Yep.
are the
Interesting group of people pushing
yeah,
for lifestyle medicine.
doctors
Yeah.
in lifestyle medicine and
Yeah.
all about metabolic health and reversing
Yeah.
diabetes, and the British Dietetic Association, and probably somebody else who I've forgotten, so apologies.
Mm.
But they are writing to NICE, the National Institute for Clinical
Mm.
Excellence, to say your guidelines have not been updated in many
Mm.
years, and we know now that there are better options than just medication. So we
Yes.
need to do something about it.
That's really interesting. I mean, we're both from clinical backgrounds and we worked in this area and we worked in this area when things were very different.
Oh
So
yes.
we considered almost none of it reversible, you and I,
Mm,
when we first worked with them. And we mostly started medications and attempted to fix the problem that way.
mm.
Let's just qualify that by reverse, it's not always possible,
No.
obviously.
So
And
it
that,
depends.
depends on a lot of things. Yeah.
Mainly, it depends on how long you've had
Yeah,
diabetes for, what the
exactly.
damage has already been done. But I
Yes.
think this is the key issue for me is if you catch it early enough, if you get somebody at initial
Oh,
diagnosis and you
yes.
say, "You're type 2 diabetic, but let's do something about it now, and
Yeah,
then you won't have these issues in the future,"
exactly.
then we'll be much further
But
better
all
down the
those
line.
years ago, when you and I first posed these questions in practice,
Mm.
um, this sounded slightly off sort of piece, didn't it? So
Well, nobody really truly believed you could actually do
no,
it.
no, exactly. And I worked with some very, very good practitioners
Mm.
in a really big teaching practice. And I remember floating the idea all this time ago of engaging patients in some serious lifestyle stuff. And doctors I worked with saying, look, it's really just not going to work. Have a go, of course. But people know how to be healthy, don't they? And they
Mm.
choosing not to be healthy. So this is maybe, a silly idea. But in truth, people didn't know how to be healthy. And we'd actually given them the wrong
The wrong
advice for a
information.
very long time.
Mm.
This was the era of low fat diets, and A-type, do you remember A-type
Yeah.
personalities
Yeah.
where people said you were more likely to have a heart attack if you were an A-type person? All these things come back to haunt me now, and I think, what did we mean? We meant what, all the CEOs out there were gonna have heart attacks. Well, there might be some truth in that because, of course, stress levels
Stress.
and all that,
Yeah.
but the fact we just wrote people into
We wrote people off
boxes.
and said,
Yeah,
you're just an A-type personality. There's no
yeah,
way you
so
can
you
ever
can't do
change. So
anything
just
about
expect your
it.
heart attack
Yeah.
soon.
Yes, exactly.
Oh
So
dear.
lifestyle advice was pretty scant, wasn't it?
I think it was a bit dodgy, really. And I think,
Mm,
um, cholesterol stuff, we still, you and I
yeah.
still roll our eyes when we hear about that. And I just
Yeah.
think,
There's
oh,
quite a lot we roll our eyes at,
oh,
yeah.
that's very true. But I think ultimately, I think we are taught, maybe from a perspective as health professionals, to just not be convinced that people can actually do anything about their lifestyle.
Yes, yes.
So
We don't
sometimes,
believe in them, do we? We
no,
we s
but
we write them off as being some other from Mars, really. So,
well, we write them off, but we also have to remember that we see an awful lot of people a long way down the line where there
yeah,
isn't anything we can do for them. And it doesn't mean that if we'd caught them earlier, we couldn't have done something for them.
yeah.
And I think, so that's one thing. There's another thing that maybe health professionals just don't find it exciting, or they're
Yeah,
not
they're not all
aware
like us. I
of.
mean, I was obsessed and very passionate about this area right from the beginning, and
Yeah,
lots of people I worked with were like, they're wrestling with their jobs in all sorts of different ways and didn't
yeah.
really have time to think about changing a whole way of thinking about
Yeah,
chronic
so we have
disease.
to remember that different healthcare professionals have different areas of specialism
Exactly.
and things that are exciting to them, so
Yeah,
that's fair enough.
yeah,
And therefore, they may not be aware of all the new science and the stuff about lifestyle
yeah,
medicine, or they are just too busy fighting
yeah,
fires because we
yeah,
know that they are under huge pressure,
yeah.
and they just can't. They haven't got the time to find out the new stuff. They're just trying to sort out the old stuff, and also
Exactly.
let's also be really aware that there are areas of the country that have huge, huge populations of diabetes. Like, you know, 70-80% of their patients will have an issue with blood glucose control. And they're simply overwhelming to kind of
Yeah.
manage all of that.
Yeah, 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 yeah. And also you need allied health professionals really to help with this. It's just not
Mm,
doable.
on your
So
own.
I mean we fantasize about, doing much more in and that's what health coaches are so good at. So I mean we fantasize about every practice in general practice here having health coaches because that's that's exactly what you need
Mm,
to make people live their very best life with whatever comes their way, and
yeah.
it's not individuals' faults, by the way.
No, so let's talk about the current state of the protocols.
Yes,
so
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 the protocols, are pretty fixed, we should say, in
they
general
yeah.
practice as well.
And they do
Um,
mention lifestyle,
they
they
do,
do, but they
yeah.
don't give it's very interesting actually. I mean, I'm gonna look it up, the NICE guideline, because from what I can remember, it just
I thought
says
they added in the option of low carbohydrate diets anyway. I mean, that's not the whole of lifestyle, but I
no.
thought they did add it as an option, actually. But
I always
they
love
might have titivated with those protocols in NICE rather than rewritten them. That's, I think, what
mm,
they're referring to. 2009 is a long time ago.
no, 2015 it's now, but it
Okay.
was published now. And let's have a look what it says. In 2009, that we're in the guideline were to encourage um, high fiber, low GI, carbs, low fat dairy products,
Our favorite.
oily fish, controlling intake of saturated and trans fatty acids,
Yeah, all that.
um, physical activity increase, losing weight,
Yeah.
um, getting a 5 to 10% weight loss, individualized recommendations for carbohydrate and alcohol intake and meal patterns. So this is really interesting because it's talking about this in conjunction with using medicines.
Yes, okay. So I mean, and your background is very much in the pharmaceutical sort of side of things.
Yes.
Um, and I suppose we should say we're not decrying all medications either. There is some conjunction um,
Well,
available.
medicines are helpful, and for
Yeah,
a lot of people, they can be very,
yeah, yeah, yeah.
very useful. And I absolutely agree that some medications in type 2 diabetes for some patients are essential.
Mm,
And not, we have to, look, we say this is a sweeping generalization. Yes, type 2 diabetes can be reversed. For some people, we can make massive improvements, but we still need to give them medication.
exactly.
And that's
So
not a,
we still may
that
need
doesn't
to
mean anyone's
control.
failed. It's not a
No,
problem. It's just that sometimes we
yeah.
have to do things in conjunction and not in silos.
I suppose that medication thing, do you remember that thing that really sort of got me was that cartoon that always explained things so simply to me of the
Yeah.
person wallowing in the bath with feet over the edge and the taps running and the water cascading over the edge of that full bath and the medication symbolically being floor cloths trying to scrum
Mop it
around
all up.
cleaning up mopping up the water
Mm.
when all they needed to do was turn
Turn
off
the
the
tap off.
taps.
Yeah.
And I always remembered that, and I always thought, "This is a fantastic." I used to draw it on a piece of paper for patients
Mm.
so that they would understand that it's not that you don't maybe need some of that the floor cloths,
No.
but you could switch the tap off at
Tap
the
off.
top,
Yeah. Yeah,
and
I
it
love
would
that
improve
because
things no end.
how many other diseases, how many other chronic
Yes,
diseases do
not
you have
many.
that option to
Yeah,
turn the tap off and you don't?
exactly.
So actually, it's a really simple way of explaining to people that
Mm.
what you put in makes a difference to what you get out. And therefore, if we tinker a little bit with the water supply and turn that tap off,
Yeah,
changing our lifestyle by what we eat, how we
yeah, yeah,
move,
yeah,
how we sleep, how we manage
yeah.
our stress, then not only do you give your medication a better chance of holding it all together, but in time, you may be able to do it without the medication, and that would be even
Yes.
better. And
Yes, so
actually,
yeah,
this comes from years of experience, but
it
most
does.
people say to me, I just don't want to take the tablets. I hate
I
them.
mean, how many times did you hear that a day?
Oh, a million. And then if anybody gets a new diagnosis, they always say, but I've got to take another tablet. And
Yes,
I'm like, yeah, I get
exactly.
you.
Yeah.
It's awful. And for some people, I grew up in a household where there was a chronic disease that nobody could do anything about and had to be controlled by
Yes.
medication.
Yeah.
But and that's bad enough, isn't it? Because you've got
Mm.
no control over that and there is nothing you can do about
Mm.
it. But if you know that you
That there
could
is.
avoid it,
Yeah.
you would be
Why
even
would
more
you not?
motivated, you would think, to do something about it.
Well, you're only motivated though, aren't you, if somebody gives you that option, gives you the information, and then inspires you.
Mm,
So
I do think a lot of
I
it
had
comes to
this
that.
great opportunity in general practice to say, look, this you're most inspired at this point than any other point at that point of diagnosis because
Mm,
people are seriously distressed by
mm.
getting that sort of major diagnosis out of the blue, by the way,
Well,
often.
yes, it's often out of the blue. I mean,
Yeah,
I literally spoke to somebody yesterday who told me that until they'd had a company medical, because they had to because of their
yeah,
job, they had no symptoms. They were feeling
yeah,
okay.
yeah,
Apart from just genuinely just being a little bit tired, they had absolutely no other symptoms that would have caused them to go
yeah,
to the doctor. It was literally a company medical peeing on a stick kind of thing that led them to have to go and
yeah.
have further
I mean,
investigations
how
and then
shocking
discovered that.
was that, you see? So they're lucky they had that company medical because they've caught it before.
Well, yeah,
They might have caught it later, you know?
interestingly, and this obviously depends on the
Yeah.
person, doesn't it? But interesting, it's not always the case that they feel fortunate
No,
that
they're
they've caught it.
cross.
They're
They're
cross,
often
yeah,
really cross. Well, I get that. I'd be cross, and I understand that. But the fact is, they've just been done a huge favor. I mean, aren't we all like that? We'd rather not know because then we don't have to have it, you know?
and we don't have
So,
to
I
do
mean,
anything
how many
about it.
times do I say that? You know, as long as you don't go to see a doctor, you're pretty healthy, actually, which is really ridiculous. But
Yeah.
I like that. Um, but once you understand the science, and I suppose that's our job, is
Mm,
and and maybe even start medications with the idea that you're going to improve your lifestyle so much that you're going to
mm,
be able to drop those medications. So no, not all medications are bad by
no,
any manner of means. It's
no,
just that the emphasis was always the wrong way round. So we
mm,
medicated, but never really inspired people to
to do
think
anything
that there
about
was
it.
some control they could take and empower them to sort of take control of their health. Because
I
actually, unless you do, they
yeah.
are always sort of on the the other end of this. So they're being
Yeah.
treated somehow, but not taking control, which
I
actually,
think this
mm,
is a way that we do things as a society, and I would
yeah,
be really interested to go into other parts of the
mm,
world and see how they approach this, because
mm,
we have a problem
yeah.
and we medicate it, and it's
That's how
like
we've taught. That's what we
it
brought up
yeah,
with, isn't
so
it?
here's the problem, here's the
Yeah.
solution, but it's not a solution, it's a sticking plaster. So
Well,
we
it's a
cover it up.
symptom controller,
Yeah. We
maybe.
cover it up, we don't actually address the root cause.
I think it's fascinating. Now we've seen this different perspective for this long.
Mm,
When you think about all the backaches, all the shoulder aches, all the knee pain, all the absolute avalanche of joint problems in this country that go into general practice,
mm,
that's affecting their lives. And everybody's given, guess what?
painkillers.
Anti-inflammatories,
Yeah.
which
Yeah,
then cause other
all
problems.
problems. But you kind of wonder whether or not it's because as a society we don't want to do the hard
I
work
I
to
think
make
it's
the difference,
normalized. I think we've
or we've just
normalized fixing
normalized
it.
it that
Yeah.
we don't need to, that we'll just have to
Someone will fix it.
yeah, eventually. But I think that's the problem, isn't it? Because if you it's almost like you hide the problem. So
Yeah.
anti-inflammatories don't help you get
No, they
better.
just
They
symptom
just manage the
controller.
condition.
Yeah.
Yeah, so it's and I just think I find that so fascinating, and
But
I
don't you
don't know
think,
whether it's just
when
because of
y
years of a particular health message that has
yeah,
taken root. And I think there's a lot of health messages that have taken root in
in the
people
same way.
in the same way.
Yeah, but
Mm,
Western medicine is a fixer of symptoms. So basically, when you train in this Western medicine style, it's all about allowing people to live their lives, and when they have a problem, they come to your door, and you have a protocol to fix them or not.
mm.
But nobody actually says, look, if we go a long way back, we can empower people to live their best lives. I mean, some of us who get chronic diseases anyway. This is not a blame thing. So
No, of
we can't
course,
say
no.
everyone who gets a chronic disease. I mean, there's so many other factors. One of them being genes, by the way, which I know we decry to an
Yeah.
extent. But
But
actually,
it's
your
about chronic
susceptibilities are
disease versus
different.
chronic lifestyle
Yeah.
disease,
I
and
mean,
that's the difference.
who knew I had susceptibilities to autoimmune diseases? Now, it's not my fault, but the way I lived would have
Precipitated
been
some of
a
that, yeah.
triggering, I might have lived quite happily with those genes in another world and not triggered autoimmune disease. So
Mm.
what I'm saying is, don't be, we can't blame people for chronic disease, but we
No,
can
no.
empower people.
Yeah, and I think, you see this in diabetes, but you see this in weight. So
Oh,
those
wait, yes,
GLP-1s now, they're
yes,
incredibly clever, brilliant drugs. They do amazing things.
yeah,
But ultimately they will only work long time if you address the source of the problem, not if you just have one Kit Kat
yes,
instead of two. It's
exactly.
not going to
No, and
it's not
isn't
gonna
that
help.
our message really with all of this is, empower yourself in terms of lifestyle as much as you can. Metabolic disease is often reversible, especially in the early
Mm.
days, but also weight is part of metabolic disease. So obesity is part of this puzzle.
Yeah.
And
Yeah, yeah,
now
yeah.
we are offering again as a culture, we're saying, okay, we've got this problem, and now we've found this fantastic
Solution.
medication that's going to sort
Mm.
this out. I mean, this is incredibly naive, isn't it?
Yeah. And at the heart of it, it's because we don't we don't have
Believe people
time.
can do it?
We don't believe we can do it. We don't feel we have time to do it. We
Mm,
think it's too hard. We failed before. We've
and
been
often
told
it's
it's not
true.
possible. And all of that is I think that's all of it. I think that's a big burden that people carry around, that
And it's
they
shame, the
yeah,
shame of it. I really understand it. So if
yeah.
GLP-1s are used in the right context, either for their multiple sort of benefits, not
Mm,
just weight. So, they were never designed just for weight.
no.
And if they're used to turn that whole thing round and give people hope for the future, and then, pack in the lifestyle changes at the same time, they could be a fantastic
Mm,
sort of
mm.
tool in that box. So I wouldn't decry them, but as we don't. But please don't just think you can fix everything. with their medication. Because what are you gonna do when you come off that medication? Or you're gonna stay on it for life, and what does that bring with it,
Mm. I
apart
think
from
it's
expense?
like
Mm.
it's really interesting actually. I mean, obviously the human approach to most things is to find the easiest path or the path of
Yeah.
least resistance.
Yeah,
And it's why people throw money at problems, and
sure.
why people who've got the funds say, well, why would I do this myself when I
Why
can
would I
pay somebody
not?
to come and do it for you?
Yeah,
Of course. Um,
yeah.
but it's not necessarily always the best method. And in
No.
health, I don't think it is.
So what you're saying is that it takes more effort actually,
Mm,
to make lifestyle changes, and I think that's very true.
mm.
So that's what we're for really, isn't it?
Oh, well, absolutely. I think, and the thing is, yes, it takes more effort, but I think you're more likely to carry on with it if you've realised how much effort it took you and then you carry on. Because
Oh, yes.
I mean, you do get to the point where it is easier to maintain the changes that you've made. So don't feel like it's
Absolutely.
always a constant battle. It's
No,
not.
no.
It isn't. But
But it's
it is
hard
still a
to
conscious
start.
choice for
Yeah.
me to get up in the morning on a Thursday and do my strength exercises, for
But you know
example.
why you do it now.
But I know why I'm doing it, and I know
Mm.
how much better I
You're
feel.
investing in yourself in a way that you never even dreamt of, and
Mm, mm.
that's
So I
incredibly empowering.
Yeah, and I think it becomes easier and becomes part of your routine.
It
And
does.
people who say to me, "Oh, I went on holiday and I still made really good choices,"
Yeah.
or "I did loads of walking." And I say, "Well, that's how you know that the little things that you've put in
Yeah.
have stuck, because
Yeah.
you could go on holiday and still do the same thing, which is
Yeah.
really important."
You know, I'm always worried about going on holiday without my rower, even though every morning I complain about it. I'm really worried now because what am I, I have to do some other things.
Yeah.
Anyway, I'm
Anyway,
not going on
back
holiday with the
to
rower, but
diabetes.
yeah.
So,
So, sum it up.
So I think, yes, basically, we are saying the more you know and the
Yeah.
quicker you know about your diagnosis, the easier is it to reverse.
Yeah.
So pre-diabetes, that is why the NHS have
Yeah.
such a big thing about pre-diabetes at the moment, and because it's
But
so
there's even
important.
pre-diabetes, as we've talked about in a
Yeah.
different
So
podcast.
yeah, depends
Yeah.
on where you are on that scale. But I
Yeah.
think knowing that you are more likely to develop a chronic disease such as diabetes, and
Yeah.
being able to do something about it earlier is really helpful. Now,
Yeah.
I'm not saying that every single person that I see who's pre-diabetic actually reverses that or
But you've got
wants
a
to.
good chance.
They know and so I think
Mm.
everybody's got a very good chance, and
Mm.
whatever. But I find it fascinating that even some people who have that diagnosis
Mm.
don't want to change
Okay.
enough to do anything about
Yeah.
that. But I think it's really important to tell people at day one of diagnosis, there is something you can do about this. It's not just a death
Yeah.
sentence or a lifelong sentence of medication. We can do more than just put you on these medicines. And the medicines are
Yeah.
great,
Yeah.
but it's a progressive disease on medication. So if we
Yes.
don't turn the tap off, you will require more and more and more, and
And
it will be
even
harder to
so,
live.
you might get complications which you
Of
could have
course.
avoided. I mean, in practice, I found people actually amazingly and surprisingly keen to
I think,
engage.
yeah. So I find people really, really keen at the moment to engage with reversal of their diabetes because it involves weight loss, more so in some
Ah,
cases than it is to reverse their glucose levels. And I find that
that's
fascinating.
interesting. Yes,
But
but isn't that because it's the seen bit
but
of
maybe it
metabolic
is.
disease?
Maybe it is. Yeah. And maybe
Mm.
because they haven't had it long enough, they don't appreciate that there could be
And
foot
isn't weight the
ulcers,
thing that
retinopathy.
people really worry
Yeah.
about?
Yeah,
They
yeah,
tend
yeah.
to not worry about their fatty livers half as much as their weight. Really interesting. I mean, to be
I
honest,
worry
both
about my
are
fatty liver,
both
Marianne.
are part of that puzzle. But if you don't have to look at your fatty liver, it's not so bad. But if you have to look at your rolls in your stomach and
Yeah.
you want to go to the beach, I mean, it's people are pretty veneered.
Mm,
I mean,
mm.
I'm not discounting myself in that. Um,
Interesting.
anyway, it's not all your fault. That's another bit of this.
Of course not.
Um,
No.
and we want you to really, get passionate about reversing metabolic disease because it is possible and empowering and so incredibly gratifying. And we've designed a
Yeah.
course, haven't we?
Yes. Can I just tell you quickly about one chap that I've
Yep.
been helping recently who's he has reversed his diabetes, and I say this in terms so that there's a definition of reversal
Yes.
which actually is still at the point of
Yeah.
diagnosis in terms of blood tests, but he's reversed it to the point of a normal
Okay.
glycemic
Yeah.
level. Oh my goodness, you just can't imagine how excited that makes. I mean, you can because
Yes.
you've done it,
Oh, well, I
but
danced around. Yes.
yeah. So you and I, we just trade these messages going, "Oh my goodness,
Yeah.
this person's reversed their
Yeah.
diabetes. It's
So
just amazing."
fantastic. Yeah.
So, even if I do think half of the battle is having somebody on your side
Yes, a
to,
cheerleader.
yeah,
Yeah. Yeah.
I do think that's so important.
Mm.
And it may not be your healthcare professional. And I think that might be a bit
Yes,
controversial,
exactly.
but in my
Well, I
experience, it's
understand.
not
Mm.
always the thing that they are most excited
I
about
mean, we're much more clued to lifestyle than we were when we were in
when we were
clinical
actually
practice.
practicing. Yeah.
Mm. When you think of I thought
Yeah.
lifestyle was incredibly boring
Yeah, and I
as a
didn't think it would do
practitioner.
much.
I wanted the big stuff. No, lifestyle, who needs that?
No, I was far more interested in calculating your renal function and working out what dose of
Exactly,
drugs you should have.
exactly. So
Yeah,
we were brought up in that culture, weren't we?
yeah. So yes, I think ultimately the most important thing is to know that you can
Yeah,
change, to
yeah,
know that even if you can't reverse it completely, which
yeah.
hopefully you can, but there are some people who can't, so we have to
No,
be really
sure,
aware of that.
depending
But
how
even if
long
you
you've had
can't,
it.
you can make dramatic
Yeah,
improvements that really
and
improve the
maybe
rest of your
drop some
life.
medications. Yeah,
Yeah. And so you won't have to take so many awful meds, yes.
yeah.
And you won't have to pay so much for all of the
Or
things
get the side effects
or get the side
or
effects.
all of that, yeah.
And you can get cheaper health insurance
Yeah, all
when
of
you go on
that, all
holiday,
of that. Yeah,
travel
yeah, yeah.
insurance. Anyway, all of that stuff. But, um, it's a hard process. So this
Mm,
is basically why we specialize in metabolic health, because we know that
yes.
changing your life is hard.
Yeah,
And that's who we are, and what we do is we come alongside
yeah.
people, and we are the people that go, "Oh my goodness, don't your blood sugars look beautiful today?" And when people hear me say that, they think, "What's wrong with that woman?"
Yeah. Well, we're passionate, aren't we? And hopefully
Mm,
that passion is useful in that cheerleading way where
mm,
you can celebrate with people about the changes they've made. But we've also made our own changes. So we are really aware how hard this is.
yeah,
It's not easy.
it's not
And
easy,
that's
but
why
it's
we
worth
designed
it.
this quirky, quick, wonderful little course. 7 days, change your life. Well, we know that's not really true, but we give you lots of information and inspiration. So come and
Mm,
see us at Seren. We call it our Kickstart course, but it'll get you going on where you are and where you're trying to go and how to start doing something. Because the other thing is floundering around. And it's very depressing to get these diagnoses. I don't think people
mm,
really realize just how depressing it is to be told that you have a chronic disease that you cannot do anything about. And people feel it's their fault in many ways because they
mm.
haven't lived very well and now they're getting their comeuppance. It's
Yeah,
not as simple as that. There's so
yeah.
many other factors.
I get so
But
many nuggets of gold from people who tell me I haven't lived a diabetic lifestyle.
oh,
And I
that's
think
interesting.
that's an
Yes.
interesting thing to say, because nobody lives a diabetic lifestyle.
No, but what they're trying to say is I don't deserve it. And I
Yeah,
get
and I think
that. I
that's,
really
yeah,
get it.
it's
We
so
do get
sad.
things we don't deserve.
We do,
Mm.
yeah.
Some of us have susceptibilities. And often, if you ask these people, of course, you can track diabetes right
Back
through
in their family.
families quite a
Yeah,
long way. Even
yeah,
if Uncle so-and-so never had it diagnosed, he lost his legs.
yeah, quite. Interesting. Right,
Okay.
well, lovely to chat,
Well,
and
what
I'll
a
see you
question,
next
I
time.
say. What a question. You
Yeah, so
know,
let's see if I mean, we could add our names, couldn't we, to the I always
yeah,
get these people wrong, PHC UK and the BDA, the British Dietetic Association. Yes, we absolutely agree that the NICE guidelines should be updated, and they
yeah.
should say you should have a health coach.
I'm very excited that the Dietetic Association's getting on board as well, because that's
Mm,
also taken quite, I mean, all this seems very slow to us. This was
yeah.
15 years ago when we were jumping up and down, and it seems to have been incredibly slow. But that is unfortunately, how slow things are. It's like turning the Titanic, yeah, and all that.
I think it is, and I think it's just I think perhaps in some respects it's not helpful to go back and say we've been waiting for a long time. It's more helpful just to push it
Yeah,
forward now and
plow
just say,
on.
look,
Yeah,
now is
exactly.
the time, go
Yeah,
with the flow, put the
we can
pressure on
help
now,
you. Yeah,
and let's do something about it, because actually as a nation and as a world, especially the developed world, we are getting sicker and we have to do
we
something
can't
about it.
afford this. Yes, exactly. But it's also people's lives, the quality of their lives. Who wants to
Well,
live out the last 10 years of your life in a chair somewhere, looked after
awful,
by
yeah.
people?
You can't
Golly.
enjoy your life. You can't
Yeah.
enjoy the company of your family and your friends. Some people get to the point where they can't even leave the house, and that's just awful.
Can't get out of a chair near. I mean, you know nothing yet. I'm seeing the other end, you know.
You
I'm
can get out
definitely
of a
getting
chair.
out my chair. No,
You
for
can
sure.
get out of a chair, especially if I poked you.
I can walk up a steep thing, but what I mean is I see lots of people of my
Age.
peers who are struggling now with mobility. So I'm really grateful
Yeah.
and empowered.
Go and do some
Right.
weights.
See you at Seren sometime soon.
See you soon.
Bye
Bye.
for now.